talking about the Figma, we're talking about iteration, we're talking about working prototypes.
Yeah, and so the benefit of rapid prototyping is getting it right the first time, or almost getting it right the first time. But not only that, being a SaaS product, we're able to release a new version really quickly. And if you look at the incumbents that are desktop installs, they often will roll out a new update, every 6 months, 2 years, depending on their cycle. But we're releasing every 2 weeks. And that doesn't impact the customer because they don't need to do anything. When they next log in, they see the latest features and they get to use that. And we measure it. We measure what's working, what's not, and then we improve on it. And it's been an absolute success to get us to where we are today.
That's great. That's great. So you take very much a co-design, co-create type approach. You're working side by side with your customers. You're feeding that into working prototypes. You named one of the tools that you use there. You're able to then get an instantaneous feedback that things are working in line with the customer's expectations, or you're able to factor in their criticism a lot quicker, synthesize it before you actually write one line of development code. So I think that's a real credit to you. I think it's the right way to be doing things in this day and age. Those long 6 to 12 month version type releases, they're not good for anyone as far as I'm concerned. The customer doesn't get the value fast enough. And as a health tech builder, you're not getting the critical information as to whether your customers actually value it or not fast enough. Indeed. So it can be a really expensive way to go if you do it the old school way.
Yeah, and look, another little process that we've recently implemented, and this is care of our founding engineer, is dog fooding. Are you familiar with that?
So as in eating your own dog food? Yeah.
Yeah.
But explain it just for those people who haven't heard it.
Yeah, so dog fooding is essentially living and breathing your own product. So not just selling it and hoping that the customers will be able to use it, but if you're living and breathing it, you're using it for your own use cases every day, then you're going to really understand what the customer's pain points are when they come to you, or even pick them up prior to then. So as a communication product, we've switched off Slack and just using Foxo. And Slack is, a fabulous communication product. And we see that as the North Star in some ways. So we've started dog fooding in Foxo now that it's at that enterprise level of communication. And the benefits are just astounding. We're pulling out all of these great insights on new features and how to make things better and faster, etc. So dog fooding is an absolute must if it can be done.
Absolutely. So, and the high level principle there is if you're not prepared to eat your own dog food, then why would somebody else?
Yes.
So definitely using it yourself, you get a firsthand empathy with what it's like to be a customer of your own product. And that usually irons out things pretty quick smart.
Indeed.
So so let's talk about the product then. So you started at the beginning, just sort of, prefacing what it was, but why don't you give us the product definition now, and we'll sort of break down who that's for, how it's actually been designed to be used, and how you see the customer journey unfolding, or what that customer experience will be like for people using Foxo.
Sure. So I mentioned Slack earlier. If people aren't familiar with that, Microsoft Teams is a fairly decent equivalent there. And we look at those products as what great communication should be in an organization. And that's where Foxo starts. So it's a communication platform that connects people in real time. So real-time messaging. But we've built that into the health space. So we've got user verification. So everyone on the Foxo network is verified. We've got integrations into leading practice management softwares, radiology information systems, and we're growing out that marketplace too. And then we've got some really novel environments that are bespoke to patient care. And so when you bolt all of those onto a messaging platform, you've got something that is a lot more than just sending texts. And that's where it begins. So we look at things like Slack and WhatsApp and Microsoft Teams, where communication is made, but we add on these extra tools to ensure that clinicians can connect with either people within their organization or beyond to their extended network to be able to do business. And business could be things like referrers. It could be making a booking or a test request to another organization. And this is where these other tools fall down, because Microsoft Teams, as good as it is, it's not purpose-built to solve a number of these problems that we've already built in. So, things like being able to communicate with another organization that's on Foxo. We make that engagement quite easy. Just look up the people, you send a request, and away you go. And from that, you can start that conversation in a secure manner, either from your phone or desktop, and all of those added tools and benefits over the top by being able to communicate around a patient, referring and test requests, and a whole bunch of other enterprise tools that we've bolted over the top of that as well. So if you're to summarize what Foxo is, real-time communication, purpose-built for health.
And I think that's the real distinction there. I understand why you would compare it to Slack or Teams or even WhatsApp as an example. But those products are not designed for healthcare. So whilst there's a lot of great wisdom contained within those products for team collaboration and communication, the healthcare system has its nuances. So what are some of those healthcare distinctions when you say it's purpose-built for healthcare? What are the distinctions as to why somebody shouldn't or you wouldn't recommend they use Slack or Teams when it comes to healthcare?
Well, it's not just Slack and Teams. It's also the other forms of communication that a lot of health providers are leaning on for communication. So, we talk about quite often when we're engaging at the investor level or at the customer level, what they're using right now to communicate internally and externally. And it's either email or WhatsApp. And also Facebook Messenger and Facebook groups is wedged in there too. And these tools are being used because you can communicate with somebody that you may not have immediate access to. So WhatsApp, for example, you can reach out to somebody quite easily. Same with Facebook groups. You can pull together a lot of users really easily. But then if you look at the notifiable data breach scheme, we're looking at health as consistently the leading sector for data breaches year on year. And a lot of this comes down to human error. So human error, and when they drill down even further, it's information, patient or personally identifiable, being sent to the wrong person mistakenly. And it's really easily done. You can send an email to somebody and away you go. You can't retract that. As much as you may try to quit the browser or Outlook as it's sending, once it's gone, it's gone. And that's the leading cause of data breaches in the health sector, or one of anyway. Up there is also cybersecurity threats too. But they're hand in hand. They're on par, should I say?
They're on par, yeah. They're pretty much not exactly 50-50, but pretty close to it.
Yeah, and look, that can be avoided really easily by just shifting over to a tool that has mechanisms in place that allows access revoking. So if you send off information in Foxo, with one click, you can retract that and you can revoke access, you can manage permissions. Additionally, that everyone on Foxo is also a verified clinician or works for a healthcare organization. So it's not just going out into the ether. And then we've got information transfer and accuracy. So when we're talking about patient care, accuracy is absolutely critical. So that's why the integrations are really important. So out of a number of the patient information systems that we've integrated with, you can press the Foxo button, the patient information can come into an environment where you can start collaborating in Foxo with a variety of users. So now you've got information in context with one-for-one parity that's come out of that system for you to be able to communicate beyond your direct, your four walls there. And then the other one is, just the fact that we log everything. So we've got a full history log that's published within the environment. So if you're communicating with me, you share a patient with me, you edit that information or you add some media, that's all documented indefinitely. So everything is documented. And, when we think about another area in health, and this is predominantly in North America, litigation is huge. And being able to track back and work out what was done and when it was done is absolutely essential for doing business in health.